the COVID-19 spread in China. Now, China is reeling under a surge of COVID cases, and as it is plagued by the spread of the new B7 of Omicron variant, the simultaneous decisions by the Chinese government ordering sudden lifting of lockdowns has made the matter worse. Now, hospitals in China are struggling, crematoriums are overwhelmed, and pharmacies are running out of medicine. Now, in addition, shocking reports of leaked notes from Chinese health officials estimate a staggering 248 million COVID-19 infections in December alone this year. Now, this is accompanied by claims that nearly 37 million people in China may have been affected with COVID-19 on a single day this week. Reports now are also saying that China swiftly is now censoring a rare state media article questioning the official COVID-19 related death toll in the country. Now, amid growing anecdotal evidence, social media reports and footage also show overwhelmed hospitals, rising fatalities as the epidemic spreads unchecked, taking off city after city. Now, this is not the first time that China has tried to censor reports related to its COVID-19 death toll, as well as the draconian measures taken by the Chinese government. I'm being joined by Sanjeev Srivastava, internal affairs expert, and also Dr. Ishwar Grada, health expert. Let me start off with you, Sanjeev Srivastava. Thank you for joining us. Talking about China, I just mentioned how they had been censoring reports from the beginning of the pandemic. As soon as COVID-19 emerged, the fact that the world found out late was also because of China's censorship. What would you like to say on, the world now holding China accountable, that it cannot simply keep things like the death toll in China a secret or brush it under the carpet, because it's an important piece of information that the world must know?
Yes. First of all, good morning to you. Good morning to my fellow panelists, and also to all the viewers, those who are watching this show. China has suppressed the information of coronavirus from day one, and this is a crime which has been committed by China. And obviously, as you mentioned, that in 2019 only, they informed about this virus to the WHO nearly after 2 months.
Right.
And by that time, this virus had spread out all over the world.
Right.
They had stopped domestic flights, but they did not stop the international flights from Wuhan to other international cities. And later on also, what we are witnessing, that China has put all sorts of hindrances to the various investigations which were being carried out by WHO and other agencies. And now what we are witnessing, that China has again suppressed the information, and obviously there is a huge question mark on the efficacy of Chinese vaccines as well as the vaccination drive, which is obviously quite poor. But to cover up that weakness of the Chinese medical system, health facilities, they came out with a barbaric, zero COVID policy, and they tried to cover up the entire weakness of the Xi Jinping's regime and his medical, system. And that is again a crime committed to the people of China this time. And obviously, what we are witnessing at this point of time, that some reports are suggesting that 37 million cases may have been recorded in a single day, which is, record breaking. And I think last time only 4 million cases, the highest number of cases, were recorded, I think, in the previous year. So in that regard,
right,
in year 2020. So in that regard, China has committed crimes time and again by suppressing the information, vital information from the international community, from the people of China. And I think it is precisely because of these reasons Chinese people are suffering at this point of time. And it is creating a very threatening situation for the entire humanity. If this kind of suppression of information was not done, obviously the international community would have been proactive in dealing with the entire situation in a much better way. So in my assessment, China has committed a crime. China must be held accountable for it. But what we have also seen, that whenever questions are raised about the Chinese medical system,
right,
they become very aggressive.
Absolutely.
And their relations with Australia and many other countries have gone down.
Absolutely, Sanjeev Srivastava. On that point, let me rope in Dr. Gilada as well. Dr. Gilada, talking about the medical infrastructure in China, sir, as soon as the pandemic hit, China was overwhelmed. They were not able to contain the virus. And from then, from say 2019, when they found out to today, they have not spent money on medical infrastructure at all. That has costed the world a lot. And over that, sir, could you help us understand the significance behind now their vaccine failing, their medical infrastructure clearly failing and not having put in resources into their medical infra, which has now led to another mutation. Could you help us understand the significance of this and why this is extremely concerning?
Good morning and thanks for having me on this show. Let me bifurcate two things. One is the internal matter of China and one is how it affects the rest of the world. Now coming to internal matter, that is their lookout, whether they look after them or not, on humanitarian basis, we should help them if they seek our help. But on the other hand, when the Wuhan virus started spreading, it was in November 2019. And thereafter, till today, I will call WHO a partner in the crime. What Sanjeev has described is fantastic, that all the events were vividly described. But despite all this thing, WHO being an intergovernmental agency, it was a prime duty of WHO to warn the world and to say that the virus has come from China. Even at this time, at crucial time, China should come out and decently say that we wanted to do some experiment and it exploded. But they must accept. WHO appointed 4 committees and 4th committee is still meeting. Privately, those people know, the committee members know, but they have signed an agreement of not disclosing anything to outside. Nothing has come out of the WHO thing. Now, only recently, last week, Tedros, WHO Director General, said that China should come out, China should do experiment, China should seek help, we will help them. All these are soft things. If you read all the sentences, it clearly says that China is involved in spreading the virus. Now coming to whether Chinese virus or this subvariant of Omicron can affect India. I don't think it can affect India. I don't think, because India has already currently land of BA.2 and BA.3. And when BA.2 and BA.3 is already there, it did not allow BA.4 and BA.5 to come. All current subvariants circulating in the world, they are BA.5 subvariant or recombinant variant of BA.5. So therefore, we are neither bothered about China, this variant coming to India, or from US, which is BQ1. Now, what can happen is if the variants are not dealt with properly, they can manufacture other variants automatically, and that can come. So if a Delta-like variant come or severe than Delta come, then we are at problem. So therefore, we always say, we cannot be at peace till neighbors are at peace. So neighbors must be at the peace, and China is not doing that. So China's 2 major faults, as Sanjeev also said that, number one is the falsified policy of controlling COVID with a zero COVID policy. COVID has come to infect all of us. Whether you want a mild infection or severe infection, it's up to you. But all of us are infected in India also. Secondly, their vaccine is very poor. I will again quote the study done in Malaysia. They compared 3 vaccines, and one of them was AstraZeneca, which is Covishield in India. One of them was the mRNA Pfizer, and one of them are Sinovac from China. Breakthrough infection, which happens after vaccination, and some people died of breakthrough infection. They compared how many deaths are there. If 1 death was there from AstraZeneca, which is Indian vaccine, 2.5 times more deaths were from mRNA, and 10 times more deaths were from Sinovac. That means after taking Sinovac also they are not immune. So at such time, China should seek help from the rest of the world, and India should come forward to help them in hours of crisis on humanitarian basis. Whatever relationship we may have with them, maybe by offering our help at this time and they accepting the help, our animosity might end forever. And we have seen that in private circumstances in our families, etc., when such thing happens. So I think at such time, we should be prepared, but over-preparedness is bad. Why it is bad? Because we try to overlook other exigencies. For example, if you just see example of tuberculosis, we lost 5 lakh lives in last 1 year. That's 21.
Right.
And in the entire 3 years, we lost only 5 lakh lives to COVID. So tuberculosis was overlooked. HIV was overlooked. There are so many other infections. Currently also in India, more than COVID, we see H1N1 and RSV viruses. So let us concentrate this on all other exigencies. All additional arrangements are in addition to the existing arrangement. Just you see in Mumbai, they have reserved 4,400 beds for COVID, whereas the total cases in Mumbai was 8 and total cases in Maharashtra was 23. So I think if you reserve bed and then other people do not get bed because there is an order from somewhere and you need to have preparedness, this kind of preparedness is not going to help us. So let's understand one thing. China is not going to bother us till they do not manufacture another variant which is more severe than Delta or equal to Delta.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.